This video contains graphic footage of a real surgery and is meant for educational purposes. Viewer discretion is advised. Hello, I am Carl Lowe Jr., and I'm going to walk you through a live laparoscopic appendectomy for a ruptured appendix. We'll start by injecting some local anesthesia, make an incision in the skin, and then insert this trocar. We'll pass the scope down the trocar so that we can look as we go through all the layers of the abdominal wall. Once we get through the abdominal wall into the abdominal cavity, we hook up our insufflation tubing and inflate the abdomen with gas. We'll look inside, and you can see that there's quite a bit of inflammation there in the right lower quadrant of the abdomen where I'm pressing. The appendix will be there. We'll insert 2 additional trocars into the body, insert our instruments, and now we can begin our work. We need to peel this fatty omentum off of the appendix. You can see the tip of the appendix coming into view, and we're going to just dissect out the appendix and mobilize it. We're going to push it over to the right of the screen. You can see that murky fluid behind the appendix, indicating this is a serious infection. The liver is coming into view there. We continue to tease some of that fatty omentum off of the appendix. And as we sweep more of the omentum off to the right, we see there's a lot of pus around this appendix, indicating that it has ruptured. We'll sweep the appendix over to the left of the screen, and now you can see where it has ruptured. Just below my grasper, you can see the rupture in the appendix, and you can see that the tissue has this black appearance where it's necrotic from the infection. We're going to place this stapling device just below the rupture of the appendix so we can staple off and divide the appendix. This device is nice because it will divide the appendix but then leave a row of staples along the appendiceal stump at the colon. We fire the device now and let it go, and now you can see the appendix is divided off of the colon with a row of staples on it. And that second firing of the stapler is dividing the blood supply to the appendix. We'll put this appendix in a bag and just set it off to the side for now. We'll take it out at the end of the case. We go back and look at our staple lines just to make sure that the appendiceal stump is securely closed and there's no leakage from the colon there. And we also want to make sure there's no bleeding. Everything looks good here. Sometimes people wonder what happens to these staples. They don't dissolve, they're metal staples, but they're also too small to set off any metal detectors. We don't ever have to go back and take them out, and they don't hurt. We're going to swing down now and look into the pelvis. Sometimes with ruptured appendicitis, pus can develop in the pelvis, and sure enough it has. So we're going to suck out all this murky fluid, and you can see there's some white pus in there too. We're sucking all that out as well. We're going to clean all this murky fluid and pus out of the pelvis. Now, I don't want any more pus to accumulate in the pelvis, so I'm going to put a drain down in the pelvis, and we're going to bring this drain out through the skin and leave it in for 4 days and take it out after that. Now that the operation is completed, we'll pull the appendix out and just take it right out through the incision here. And there's the appendix. We'll take our drainage tube and hook that to bulb suction to suck out any other fluid that tries to accumulate in the pelvis, and then we'll close our skin incisions. This patient felt much better after getting that inflamed appendix out. He spent 4 days in the hospital, and on that day I took out this drainage tube, and he went home in great condition. Thank you for your interest in this surgery.